I'm curious to talk to you a little bit about minimum wage payments, but we've had a lot of conversation about raising the minimum wage up to 15 from 7.25. But what we haven't talked about very much is that there exists a class of people who are sub-minimum wage employees. So is there any plan or policy or stance from your department on what to do about perhaps giving sub-minimum wage employees an opportunity to share in the increase of the minimum wage up to $15 an hour? Will they benefit from that effort?
So thank you for the question. And raising the minimum wage to $15 an hour and by January 1st, 2024 will result in about 1.5 million people being helped. The details lie with all of you, and whether this is a tiered increase in wage, whether it's indexed, whether it's one fair wage, that is what you all have to work out. But I can say from the governor's perspective, getting as many people as possible to $15 an hour as quickly as possible would be certainly our objective and hope.
And is there any particular stance, because if not everyone is aware, because some people may not be aware that there is a sub-minimum wage classification, because you'd think minimum means the minimum, but it doesn't. There is, of course, a lower minimum wage for tipped workers, sometimes wait staff, for instance, at restaurants, but also some individuals with intellectual developmental disabilities are legally permitted to be paid far below the state minimum wage. So I know that there is a lot of discussion that goes on with that, where you have to balance the ability of some people to take part in meaningful work at a lower rate of pay versus treating people, frankly, like they belong to society and get paid as much as anybody in our society at that minimum wage rate. So I'm curious if that has been an item of discussion of paying individuals with disabilities the minimum wage as opposed to a sub-minimum wage.
So I can tell you that we work aggressively to make sure that people have competitive integrated employment. We have a number of programs that we're working on, the INVEST program, and I can have Ryan speak in more detail, but we're taking advantage of federal grant opportunities to make sure we're working with employers and families of individuals with disabilities to make sure that they are in competitive integrative employment and not receiving sub-minimum wage, and that the employers have the kinds of supports during training periods and all to make that happen. And with your permission, I'll just have Ryan address that in a little more detail.
Yeah, thanks for that great question. OVR received a $14 million federal Disability Innovation Fund grant last October. So the first year for helping individuals either stay out of subminimum wage employment or get out of subminimum wage employment. So the first year that we're in right now is an administrative year, and then the next 4 years will be working with employers, working with families, working with provider agencies to build supports around individuals who are seeking competitive integrative employment to do that, so that funding from the federal government will be used specifically to target those populations. So it'll be 2 employers per year. It's a small number of individuals, but it's basically to pilot and explore what else we can do in Pennsylvania to help that population. And of course, Pennsylvania OVR is always about competitive integrative employment. So if somebody is interested in working in the community, then refer them to OVR.
My understanding is that the FLSA language that allows disabled individuals to be paid below minimum wage dates from the 1930s. So I would like to think that in the past 90 years, we've made some advancements in our understanding of how to treat individuals who experience disabilities and hopefully give them an opportunity to earn a fair wage. As I said, I do understand that some people do advocate that the sub-minimum wage system provides people with disabilities with an opportunity to take part in a workforce when they might not otherwise be able to. But at the same time, I do have a concern that there are also potentially some individuals who are being exploited, who are potentially able to work at that minimum wage and above level and are being kept at sub-minimum wages in an exploitative manner. Do you have any data, or have you done any research on whether that is an issue in Pennsylvania?
We hear similar complaints or concerns. Pennsylvania OVR is required by federal law to go out to all the sub-minimum wage employers and do counseling sessions on competitive integrative employment. So we do that at least annually. Sometimes it's more with any participant. So they're aware that they have options outside of the sub-minimum wage facility. So we do that. And between the pandemic and societal changes, when we first started doing 511 under WIOA in 14, it was around 10,000 individuals, and now we're around 5,000 individuals. But a lot of that was a result of the pandemic and changes in availability.
Thank you. I appreciate your responses. Thank you very much.